I'm not committing to it or not committing to it. What I'm saying is that we do a deliberative process. We've got to bring down the costs, and you can do that in a responsible way that also increases access and quality of care. And we got notebooks full of ideas on how to do that. We're going to do in the House what we always do. That is a deliberative process. We have to find consensus on whatever the proposal is.
And joining me now is my Republican source, a doctor and a senator from Kansas, Senator Roger Marshall, who drew the short straw and is outside with me while Senator Merkley was inside. And thank you for being here with us. I do think there's a big question of John Thune has offered this assurance that there will be a vote at least next month. You just heard Senator Merkley there saying he doesn't really think it's going to go anywhere. But do you think if it does, that House Speaker Mike Johnson should bring it up for a vote in the House as well?
I don't know if he should or shouldn't. I want to get locked in on bringing down the cost of health care, regardless. And I think that's what you're going to see the House doing as well as us doing. We want everyone to have meaningful, affordable access to health care. We want to make people healthy again. And let's talk about how we're going to do that. We're sending $150 billion a year to big insurance companies. Let's take that $150 billion. Let's give a part of that to consumers, to patients, and set up better HSAs for them. Give them more choices out there. Let's expand community health centers where people can get access to more primary care as well. So let's talk about solutions. Like Senator Merkley said, let's focus on the future, and we're ready to get to work.
Okay, so I think some people might say, well, what is the plan? What is Republicans' plan to bring down health care costs?
Yeah, so let's focus just on the people in Obamacare. The good news is the Democrats all agree with us that it's unaffordable, that it didn't work. So number one,
they don't all agree, but some of them, Senator Bernie Sanders and folks might agree.
I heard a lot of speeches like that. So anyway, I think number one is we address the fraud within that program. There's about $25 billion of fraud. I talked about already, let's take that $150 billion we're giving insurance companies, give about a third of that back to patients, to consumers, to set up their own healthcare savings accounts. Beyond that, there's work to be done with roll back the PBMs when it comes to prescription drug prices. Trump RX is going to be something else that'll work. We can expand access to association healthcare plans, to ministry plans as well. We want to set up high-risk pools, reinsurance pools in every state as well. So there's a lot of things we can do. These are not new concepts. Speaker Johnson and I have been working on this together for years.
So, well, you've been working on it for years, but is there like a comprehensive plan that people could look at and decide whether or not they think it's something that Republicans should pass?
We'll have something within that when we'll have a side-by-side bill when they come out, when they get their vote on Obamacare subsidies, giving more.
You're going to have a health care bill by the second week of December?
We will. We've been working on this very, very hard for several years. And again, Speaker Johnson and I have done one several years ago, but we'll get a new one, getting it together. We're bringing the pieces together just like I discussed. Again, taking $150 billion rather than giving it to big insurance companies. Let's empower patients, make them consumers again. Let them make the choices that they want to do. The other big piece to the bill, and again, this is already written, you can look it up, it's called our price tags bill, which is going to allow patients, before they have that knee surgery done, they can compare one hospital to another, compare the prices and the outcomes.
So you're saying Republicans will have a comprehensive health care plan to vote on when the Senate votes on those extending the subsidies?
Yes, we will.
And it's going to address people who have cancer or pre-existing conditions or don't know what to do if their premiums are spiking at the end of December?
Absolutely. We're going to have to figure some type of a off ramp for people that are over the 400% of income, especially. We got to figure out what to do with them. It's very tough. Again, the insurance companies have put the shaft to American consumers for so long. Our premiums have went up, they've doubled since Obamacare care came around, and the insurance companies' values of their stock have went up more than 1,000%.
So you'll vote no on the health care subsidies vote next month, I presume.
Absolutely.
And then you'll have this plan laid out, and Leader Thune's going to bring it to the floor for a vote?
Yes, and it's not going to be perfect. I think there'll be more work to do after that. We're going to do as much as we can to get something ready by then, and then hopefully before the January 30th deadline of this next continuing resolution, we can work on a bipartisan way. And by the way, these 8 people that walked across the line, they are absolutely profiles in courage, and they're going to be very central to what this bill looks like.
Can I ask you what someone who is listening to you tonight might say? Okay, Republicans don't like Obamacare, but they've had 15 years to change it, and they haven't introduced that plan. What would you say to someone who's skeptical of Republicans having a plan by December?
Yeah, Speaker Johnson and I introduced one several years ago.
So will it look like that, do you think?
I think it'll be a lot of changes since then, a lot of more water underneath the bridge. I think we're going to be much more aggressive, taking money away from big insurance companies and giving them to patients.
I want everyone to listen to what you're talking about, insurance companies taking all the money earlier. You mentioned this on the Senate floor yesterday. I want everyone to listen to just part of your speech from yesterday.
Okay.
Get this, 35 to 40% of Obamacare recipients that are enrolled in Obamacare never file a claim. Let me say that again. There's 24 million people on Obamacare. 35, 40% of those people never file a claim. These are ghost people. They don't even know they're on Obamacare. They've been falsely enrolled in Obamacare. Now, some people would say, "Oh, but there's always some people that don't file a claim."
Some people might have listened to that and said, okay, but that's how insurance works. You're pooling risks. And that just because you don't file a claim doesn't mean you don't need insurance. I mean, you have life insurance, you have fire insurance. It doesn't mean your house